Healthcare-associated infections, HAIs, account for over 2.7 million infections and 100,000 deaths annually in U.S. hospitals alone. Between 14 to 16% of all HAIs are related to surgical site infections. According to the U.S. Centers for Disease Control and Prevention and the World Health Organization, there are 3 principal elements required for an infection to occur: a source or reservoir, a susceptible host with a portal of entry that would receive the infectious agent, a method of transmission. The content of this video is in accordance with the latest AORN recommended practices for transmissible infections and the evidence-based guidelines from the Centers for Disease Control and Prevention. All content of the video was current as of the time of filming and publication. Always consult the latest evidence-based guidelines for the most current infection prevention information. Due to the evolving nature of microorganisms and disease transmission, this video is intended to discuss techniques to protect both the healthcare provider and the patient from infection and occupational exposure to a variety of infectious materials. AORN recognizes that there are numerous types of settings in which perioperative nurses practice, which include not only the traditional OR setting, but also ambulatory surgery units, physicians' offices, cardiac catheterization suites, endoscopy suites, and other areas where operative or other invasive procedures may be performed. Each one of these environments presents unique hazards to patients for acquiring a healthcare-associated infection. It is imperative that each facility develop a formal infection prevention and control policy to mitigate the risk for HAI transmission.
If you have any questions, or if your employees have any questions, you should know that, as you already probably know, the policies and procedures are all on the hub online for the infection control, and they're easily accessible if anybody would have any questions or need to refer to them.
In this video and accompanying study guide, we will review the role of infection transmission in the development of healthcare-associated infections, discuss basic prevention techniques such as hand hygiene in the mitigation of healthcare-associated infections, review the immunizations necessary to prevent vaccine-preventable diseases, review the role of evidence-based practices in the prevention of healthcare-associated infections. AORN recommends that healthcare workers use standard precautions when caring for all patients in the perioperative setting. Hand hygiene has been identified by the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, as the single most important intervention to reduce the transmission of infections. Healthcare providers should adhere to either the CDC or WHO evidence-based guidelines for hand hygiene in healthcare settings. Healthcare providers should utilize traditional soap and water or a facility-approved alcohol-based hand rub, which is available in the form of gels, foams, or wipes with alcohol concentrations between 60 and 90%. Certain microorganisms, such as Clostridium difficile, require a modified approach to hand hygiene. Because of the spore-forming nature of this particular pathogen, healthcare providers should wash hands with soap and water and not use traditional alcohol-based hand rubs. All patients should be treated as potentially infectious to ensure consistency in the use of precautions in the healthcare setting, such as gloves and other personal protective equipment. The use of PPE protects healthcare providers' mucous membranes, airway, skin, and clothing from coming into contact with blood, body fluids, and other potentially infectious materials. OPIM.
Just a little nervous?
I think so.
I'm so sorry about that. Just give you a minute here and see if your stomach settles down a little bit, okay?
Okay,
I'll
thank you.
take that for you.
Environmental cleaning and disinfection should also be performed as surfaces in patient care areas are known to be reservoirs for infectious agents. Clinical studies have shown the ability of various microorganisms to survive on environmental surfaces from days to months in some cases. Many pathogens can be transmitted via the airborne or droplet route. All persons should practice respiratory hygiene and cough etiquette. According to the CDC, healthcare providers, patients, and their families should cover the mouth and nose with a tissue when coughing. Dispose of a used tissue quickly. Perform hand hygiene immediately after coming in contact with respiratory secretions. Separate patients with a respiratory infection from others, and ensure that those with respiratory infections wear a surgical mask.
It will help the prevention of infection, spreading infection, and it goes over your nose and behind your ears. And sir, if I could have you also use our alcohol foam on your hands so as to prevent further spread of infection.
Okay.
And just pull the lever forward and rub it between your hands. That's great, thank you.
Sure.
In addition, there have been recent outbreaks of HIV and hepatitis associated with improper injection practices. The CDC has a campaign to address unsafe injection practices. The basic premise of this campaign is to use one syringe and needle one time and promptly dispose of it. Special precautions should also be followed when using multi-dose vials. Process monitoring for the use of multi-dose vials is a key component of an infection control program. Institutions should ensure that they are adequately meeting all regulatory, public reporting, and accreditation guidelines regarding process monitoring.
Morning, Mr. Smith. I'm ready to start your IV.
AORN recommends that contact precautions be used when providing care to patients who are known or suspected to be infected or colonized with microorganisms that are transmitted by direct or indirect contact. Many infectious pathogens are transmitted after contact with these patients, mostly through contaminated hands and/or environmental surfaces. Healthcare providers are prime sources for contamination and transmission, and thus must take special precautions to reduce the risk for transmission. Anesthesia care providers maintain close contact with patients and therefore should wear a gown when caring for patients on contact precautions, and other unscrubbed personnel should wear a gown when it can be anticipated that clothing will come into contact with the patient or contaminated surfaces. It is sometimes necessary to transport infectious patients to other units within the facility for diagnostic tests and procedures. Special precautions should be taken to minimize the risk for transmission to others, such as the use of a mask, isolation gown, or additional sheets. Healthcare providers should follow the latest evidence-based guidance from the CDC guideline for prevention of multi-drug resistant organisms. Non-critical items are those that come in contact with intact skin only, such as blood pressure cuffs, stethoscopes, and computer keyboards. These items should be carefully cleaned and disinfected with a minimum of a low-level disinfectant between patients and when visibly soiled. AORN recommends that droplet precautions be used throughout the perioperative environment when providing care to patients who are known or suspected to be infected with microorganisms that can be transmitted by large droplets.
Maybe your throat's just a little dry because you haven't had anything to drink.
Yeah.
No fever? Okay, good. All right, sounds wonderful. We'll get going with things here in just a minute.
It's okay.
Droplets have been shown to travel great distances, up to several feet, which can result in transmission of disease. Healthcare providers should wear the appropriate PPE as part of droplet precautions. This use of PPE will properly protect the healthcare provider's most vulnerable areas, such as mucous membranes, airways, skin, and eyes from coming into contact with potential infectious materials. The use of masks prevents the transmission of large droplets such as influenza. They must, however, be worn correctly and changed at the first sign of failing, such as when moisture is identified, as it can compromise the mask and other PPE.
Hi, Jen. Can I get you anything?
Oh, hi, Ann. How are you?
Oh gosh, it looks like your mask is wet. You're gonna.
Oh,
need to
is it
change
really? Oh, thank you very much.
Sure.
I will. I'll change it right now.
In addition, the perioperative nurse should ensure that all patients with respiratory infections be kept at least 3 feet away from other patients. AORN recommends that airborne precautions be used when providing care to patients who are known or suspected to be infected with microorganisms that can be transmitted by the airborne route. Airborne transmission has long been proven as a formidable mechanism to transmit organisms in a variety of healthcare settings. The most notable example of this is tuberculosis. This type of transmission can occur when airborne droplet nuclei or small particles that contain infectious agents remain infective over time and distance. Examples of these types of diseases include TB, varicella zoster, and rubeola. Special airborne precautions should be taken in the OR, including PPE, respiratory protection, and environmental and administrative controls.
Oh, I see here that they've added Mr. Smith onto the schedule, and it does have a notation here that he has TB. So we'll need to make sure that he gets placed in an isolation room prior to and after.
Examples of administrative controls are training and education and TB management programs. Examples of environmental controls are use of HEPA filters and proper cleaning of equipment. Certain infectious agents such as norovirus, influenza, or rhinovirus are not able to travel for long distances, and therefore a surgical mask is sufficient for prevention. N95 masks, however, should be worn for a patient that requires airborne precautions for diseases such as TB.
Okay, Mr. Smith, this room is going to be yours for the next little bit.
For these types of patients, an airborne isolation room, such as a negative pressure room, should be utilized if possible. These rooms will minimize risk to the staff and other patients.
So we'll need to make sure that he gets placed in an isolation room prior to and after.
For these specialized patients, the perioperative nurse should consider scheduling these patients as the last case of the day. Performing the procedure in an OR with the necessary environmental controls, and performing the procedure with the minimum number of personnel required to minimize unnecessary exposure. A single-use disposable filter should be placed between the anesthesia circuit and the patient's airway. Following extubation of the patient, the OR doors should remain closed until adequate time has passed to allow the air handling system to clean 99% of airborne particles from the air. AORN recommends that perioperative personnel wear personal protective equipment when exposure to blood or other potentially infectious materials, OPIM, is anticipated.
Now, I just want to make sure I have your name hand over here. Okay.
OSHA requires all employers to provide appropriate personal protective equipment to healthcare providers, including the perioperative nurse to reduce the risk of skin and mucous membrane exposure to blood and body fluids, or OPIM. The perioperative nurse should wear a gown and gloves when hand contact with blood, or OPIM is likely to occur, which can include basic vascular access or catheter insertion procedures. When coming into contact with contaminated patients or environmental surfaces, or after touching contaminated patient care items.
Are you just a little nervous?
I think so.
I'm so sorry about that.
Thank
I'll
you.
take that for you.
Thank you.
Healthcare workers should wear fluid-resistant attire during any activities which may generate splashes, splatters, sprays, or aerosols of blood or OPIM. This can include gloves, gowns, respiratory, and eye protection. Some PPE requires the perioperative nurse to be specially fitted to ensure an adequate protective seal is made, such as N95 masks. AORN recommends that perioperative personnel take additional actions during surgery to prevent infections. There are several main types of infection that are known to occur as a result of the surgical process, including multi-drug-resistant organism infections, surgical site infections, catheter-associated urinary tract infections, and central line-associated bloodstream infections. Perioperative nurses should carefully consult the latest guidance for prevention from the CDC, Association for Professionals in Infection Control and Epidemiology, the Infectious Disease Society of America, and the Society for Healthcare Epidemiology of America. According to the latest statistics from the CDC, surgical site infections, SSI, are the third most reported HAI, accounting for up to 16% of all HAIs reported in hospitalized patients. The CDC and others have identified several basic techniques to prevent SSI, which include proper environmental cleaning, using appropriate barriers and surgical attire, proper and adequate sterilization procedures, minimizing traffic in the OR during the procedure, use of antimicrobial prophylaxis, proper skin antisepsis and hand hygiene, proper use of sterile and aseptic technique. To prevent and control multi-drug-resistant organisms, MDROs, the CDC has identified several key strategies. Seek administrative support for the initiative, fully utilizing contact precautions, performing proper hand hygiene, managing invasive catheters, quickly diagnosing and treating infectious etiologies, performing environmental cleaning and disinfection, preventing antimicrobial resistance, using active surveillance cultures as necessary, educating staff and patients about their role in prevention. AORN recommends that healthcare providers be immunized against epidemiologically important pathogens. The CDC Advisory Committee for Immunization Practices, ACIP, issues regular updated guidance on the appropriate vaccinations for both patients and healthcare providers based on the emerging clinical evidence available. Vaccinations play a critical role in preventing disease acquisition and transmission. The ACIP recommends vaccinations for healthcare providers that fall into two unique categories. The first category includes those diseases for which routine vaccination or documentation of immunity is recommended because of risks in the workplace. These conditions include hepatitis B, seasonal influenza, measles, mumps, and rubella, and also pertussis and varicella. Immunizations for hepatitis B, for example, are mandated by OSHA. The second category is for certain exposures. For example, a nurse caring for a patient with meningitis should additionally receive the vaccine for meningitis as well. Certain vaccinations require annual boosters, such as the influenza vaccination, so careful monitoring should take place to ensure that all healthcare providers, including the perioperative nurse, are properly vaccinated unless contraindicated. AORN recommends that the activities of healthcare personnel with infections, exudative lesions, and non-intact skin be restricted when these activities pose a risk of transmission to patients and other healthcare providers.
Anne?
Yeah,
Can I talk to you for a second?
Sure.
I'm sorry. I'm supposed to scrub today, and you just noticed I have this rash on my arm. Can I still scrub the case?
Yeah, no, that doesn't look good. You're really not supposed to be scrubbing. So we're going to need to actually send you to Employee Health and have them take a look at it.
Depending upon the type of infection, the perioperative nurse that is suffering from a current infection may require restricted work duty. The facility's employee health nurse, infection preventionist, or physician should assess all ill employees and determine whether their condition requires a modified work assignment.
Okay.
Any employee with non-intact skin, exudative lesions, and those with known active infections must be medically cleared prior to reporting to work.
Day surgery, this is Anne.
Hi, Anne. Anne, it's Ashley. I'm really...
Bless you.
I have a terrible cold right now, and I do not feel like coming into work today.
Oh, I'm sorry you feel that way, Ashley. I know it sounds like you have a terrible cold.
Oh, it's miserable.
The facility should openly encourage reporting of employee illness and work carefully with human resources to build a policy that is not punitive towards the reporting employee. Certain infectious conditions will require a modified work assignment to prevent transmission to other healthcare providers and/or the patients, including acute gastrointestinal illness, keratoconjunctivitis, pediculosis, scabies, herpes simplex infections, exudative lesions that cannot be contained and covered, meningococcal infection. AORN recommends that perioperative personnel receive initial and ongoing education and competency validation for appropriate prevention measures for transmissible infections and MDROs.
And these we see all the time. Okay, we wear these more often. These you may remember from your employee orientation or when you were first newly hired. These are the N95 masks. You see they're different sizes and they're a little stiffer, okay? But the reason for that is because you, as you may or may not remember, we were all form-fitted, so they fit your face and they prevent the spread a little more. So this is the difference. Yellow we see all the time. These you would have to seek out for the patients that have the TB that we want to be sure and protect against. Yes.
So, Ed, I've forgotten, what's so different then about the N95 mask?
Well, besides their obvious look difference, but the real function is they have a more dense filtration system. They filter between 10 and 100 microns, and we've got a form here that actually, if you wanted to see the technical parts of it, it would show, but this form fits and it filters more dense particles for the airborne diseases such as TB, varicella.
The perioperative nurse should consult with the facility's infection preventionist to develop, maintain, and annually update facility-specific policies and procedures.
As you can tell, this patient has been placed in an isolation room, and you can tell that they've posted the appropriate sign up here indicating that this patient is on droplet precautions.
Staff should receive annual training regarding the appropriate application of isolation precautions, particularly contact precautions.
You'll see the isolation cards outside the room, and there are masks here for you to put on before you go in. There are different types of isolation as well. The other type you may be aware or you may see frequently is the contact precautions. And in that case, rather than wearing the mask, you would wear gloves and a gown, also here on the cart. Put them on before you go into the room. Take them off before you leave the room. Okay?
There are numerous prevention methodologies that should be included in new hire orientation, as well as annual competency. These include the following: appropriate use of standard, contact, droplet, and airborne precautions, appropriate use of personal protective equipment such as gloves, mask, and eye protection, compliance with the OSHA Bloodborne Pathogen Standard and Sharp Safety Act, appropriate use of disinfectants and cleaning products, evidence-based guidelines for the prevention of surgical site infections, catheter-associated urinary tract infections, and catheter-associated bloodstream infections.
So today we have discussed numerous infection prevention guidelines and methods, but we want to especially thank our vendors, Steve and Joanne, for being here with us today and for taking this OR protocol course. We want to congratulate you, and you have been presented with the official cards that will let you in the door and the lovely red hats. Thank you again.
Healthcare industry representatives, or HCIRs, should also be trained on prevention of infection. AORN recommends that documentation reflect activities related to infection prevention. Documentation is one of the most critical components to ensuring patient and clinician safety. It is considered a professional medico-legal standard. Documentation also serves as a basis for monitoring compliance, measuring performance, logging exposure incidents, and maintaining employee records.
The Preventing Transmissible Infection Recommended Practice now includes a surgical wound classification decision tree, and using this tool helps you determine what wound class you need to document.
Chris, so does that mean that you would elevate the wound classification, let's say, who has hepatitis C and is having a hernia repair?
No. As a matter of fact, you would keep it the same.
An example of a documentation activity that relates to infection prevention is documentation of the patient's wound class. AORN has a wound class decision tree that is helpful in determining appropriate wound classes for surgical patients. Vaccinations can provide the necessary immunity against several transmissible infections. The CDC publishes guidance on the recommended vaccinations for healthcare providers. Employee vaccinations records should be maintained by the employer and regularly reviewed. The vaccination record should include the type of vaccine given, the date on which the vaccine was given, the lot number and manufacturer, any adverse reactions, the location on the body where the vaccine was administered, the name, address, and title of the person who administered the vaccine. Documentation that the appropriate CDC Vaccination Information Statement, VIS, was provided to the employee who received the vaccination. Some vaccinations require testing to ensure continued immunity, which can be determined through a titer blood test. Additional vaccinations may be required if the titer results demonstrate the vaccine has lost substantial efficacy. Recently, several studies have identified the need for routine monitoring of environmental cleaning and disinfection. While this is an emerging science, there is certainly promise of this new technology. There are several mandatory reportable conditions, including occupational exposure due to a needle stick or blood exposure to ensure compliance with the OSHA Bloodborne Pathogen Standard.
Talk about it.
Okay.
Okay, Steve, well, tell me what you were stuck with.
It was a suture needle.
Okay, all right. And where were you when that happened?
I was in the decontamination room in sterile processing.
All right. Can you tell me a little bit more about what actually happened?
I was taking the items out of the tray, trying to open up the lock boxes, and I reached in there and I felt something sharp, and that's when I noticed the needle in the basket.
I see. Okay. Do you by chance have any patient information about that tray that you're working with?
I did have the count sheet. I think I left it on the front desk downstairs.
Okay. All right. Well, let's get that information, and then we need to go over to Employee Health, where they will have you fill out some more information, and we'll proceed with taking care of this situation.
Okay.
Okay?
All right.
All right.
Surgical site surveillance is a critical component in quality improvement for the prevention of HAIs. The CDC's National Healthcare Safety Network, NHSN, has developed specific criteria for the classification and reporting of surgical site infections. The Occupational Safety and Health Administration requires that training records for bloodborne pathogens be kept for 3 years. These records must include dates of training, content of the training, names and qualifications of trainers, and names and jobs of those trained. Sharps logs must also be kept and include the type and brand of device involved, the department or work area where the exposure incident occurred, and an explanation of how the incident occurred. The exposure incident records must be kept for the length of employment plus 30 years.
So.
Protecting patients and healthcare personnel continues to be a challenge in today's rapidly changing healthcare environment. Newly recognized pathogens and well-known organisms that have become resistant to current treatment modalities have added to this challenge. Preventing transmissible infections is a priority concern in the perioperative environment as we strive to give our patients the best care possible and protect them from harm.